Hello, I'm Nicki Herriot, Chief Executive Officer of Northern Territory PHN. In early June, NTPHN hosted 6 health discipline students from across Australia for the annual CARA Health Leads, a week-long program that develops essential rural and remote leadership skills for emerging health professionals. Held in Alice Springs, the students participated in Indigenous cultural sessions, visited hospitals and local communities, and attended leadership programs. NTPHN works in partnership with Rural Health Workforce Australia, the Centre for Remote Health and the University of Tasmania to provide the students with an informative and insightful experience. This equips them with the skills and knowledge to best support rural and remote communities as future health leaders. I'm pleased to share our recent engagement in CPD Day, known as Darwin Pop-Up PHN, was a successful, well-attended event. Based on the positive feedback of our stakeholders, we will be hosting a second round of Pop-Up PHN events in the later half of the year. As NTPHN is a member of the Northern Territory Aboriginal Health Forum, I attended the quarterly meeting recently. Our Executive Manager Clinical, Dr. Tamsin Cocaine, came along to present on Phase 1 of implementation of healthcare homes in Australia and progress with implementation of the Health Pathways program. Along with Executive Manager Workforce and Practice Support Susie Wise, I attended a Rural Workforce Agencies meeting in Canberra. NTPHN has the NT Rural Workforce Agency as part of our organisation. The meeting was hosted by the Department of Health and was an opportunity to discuss the strategic directions of the new Rural Workforce Support Program. We were fortunate to meet with the Honourable Dr. David Gillespie, Assistant Minister for Health, after our meeting. We're really excited to have been provided the funding to establish a Headspace service in Katherine. We're working with the community and our partners down there to actually implement a model that meets the needs of that community. It's really exciting that we've actually reached that milestone, and it only seems like yesterday that we actually started the NTPHN, and we've just achieved so much in those 2 years. It's been a really rapid growth period for us, and it's really been challenging for the organisation to adapt as quickly as we've needed to. And it's really clear to us now that we need to be able to work at the macro level of the health system, so working across the system with health partners, at the meso level where we're actually commissioning services on the ground, and then at the micro level where we can try and improve better integration so that people who get our health services actually receive better care. I'd really like to thank our staff for their dedication and loyalty, and also thank you to our stakeholders and our providers who have come on the journey with us. General practitioners and health professionals can look forward to a weekend of networking, education and continued professional support from NTPHN and NTGPE's Compass Teaching and Learning Conference on 13th to the 15th of October. This year, Compass will coincide with the presentation of the Health Professional of the Year Awards and the Administrators Medals to acknowledge the significance of health professionals in our community. Thanks for watching this message, and I look forward to talking to you next month.